This is Megaphone from Medvale Media. I'm Dave Self. This is where we hand the megaphone to healthcare leaders to share their thoughts, their perspectives, and the occasional rant about the increasingly dynamic world of healthcare. And today it's a real privilege to welcome Tim Raderstorf, co-founder of SteadyWell and a new-ish member of Medvale. He's been around now for a bit and he's engaged in an awful lot. Tim, welcome to Megaphone.
Thanks so much for having me here, Dave. I'll keep the occasional rant comment to mind here. I'll try and limit mine as much as possible.
Hey, man, the rant away. When we hand you the megaphone, it's all yours. Now, before we dig into SteadyWell, Tim, and the challenge of leading a startup, let's step into the Wayback Machine for just a minute and learn more about you and what led you to co-founding your company.
Yeah. Going way back, I grew up in a suburb of Dayton, Ohio, and went to a prep school there. And if you were good at math and science, they told you to be a physician. If you weren't, they told you to be a lawyer. So I found myself at Ohio State, coming from being a relatively big fish in a small pond to the smallest fish in the biggest pond, and was a little bit lost and aimless in that journey. I actually created my own pre-med major there because at the time you could only be chemistry, biology, or human nutrition, and none of those really got to the human element of healthcare to me. So I created my own major there called humanistic medicine, and it combined psychology and sociology, from pediatrics to gerontology, and really just focus on being with people, and it not in any way knocking my physician friends, but I should have realized at that point that maybe being a physician wasn't the best path for me. I also spent my summers there working for my godfather, who's a neurosurgeon, as his research intern, and got to see how challenging the life of a surgeon was. So there are all these uh, data points coming at me, and I was doing a pretty good job at ignoring them. I still took the MCAT, and was going down that path. And then after my senior year, my brother had been volunteering with Paul Newman at his summer camp in Connecticut for kids with chronic
Really?
illnesses. And if you haven't heard of the association, it's now called Serious Fun, but it was originally called the Hole in the Wall Gang Camp. And this is what Robert Redford went out and started the Sundance Film Festival,
Right.
after his or during his movie career. Newman went on to be a Formula One race car driver world champion.
Yes.
And in the early 80s, the story goes that a reporter asked him, what do you want your legacy to be? Do you want to be known as a world champion race car driver or a world-class actor? And he said, none of those. So he thought about it and saw what was going on with the HIV epidemic and kids being down on their luck with getting cancer diagnosis, and thought, I want to give them, in his words, a place to raise a little hell. So he started the Hole in the Wall Gang Camp in Ashford, Connecticut, in the late '80s, and I found myself volunteering there after my senior year in college, and saw essentially what was a pediatric hematology oncology clinic that had one of the best summer camps in the world built around it. So kids would go there and they'd get infusions and would be able to be on chemo if it was oral while they were there. But they were just treated like kids for a week, and you got to see what happened when we remove some of those labels that we place on each other and just let people be themselves. So I let myself do that too, and instead of thinking I had to be a physician, I saw that while there were physicians at the camp, it was really run by a team of 7 nurses who were there year round, and then 5 volunteer nurses would come in each week as well. And I saw how they got to interact with the kids, and I thought, oh, that's what I want to do. So I came back the next summer and worked there full time. Fell in love with the lifeguard. We now have 4 kids. But I worked there the next summer after that too, right before I started my master's in nursing at Xavier University. And then when I finished that degree, I ended up working in that dream job as the pediatric hematology oncology nurse at the bedside, and got to experience, the other side of that, of when we did put the labels on the kids, and what it looked like when they were in the 4 walls of healthcare, and did my best to kind of break down those walls as much as possible. But after that, my career snowballed pretty quickly. Because I did a master's degree direct entry program, I got asked to be the manager of our ambulatory clinics about 11 months into my clinical care. So I was then managing people who had been nurses longer than I was alive, and learned a lot about what not to do as a leader. A very formative process for me during that time.
Yeah,
Um,
anyone who's gone through that process probably bears those scars forever, but it's great learning.
I mean, I still think of those moments fondly and cringe a little bit at it too, of knowing, how much better I could have been, but how unprepared I was. And like that's okay. You're not going to be prepared for every situation you go into. And it really uh allowed me to get comfortable with being uncomfortable and knowing that when you're uncomfortable, that means you're growing. Um and the growth and comfort just usually don't coexist. And that position definitely gave me a lot of uncomfort and growth for sure. But it also catalyzed my career. So because of being in the right place at the right time, which I think you'll, as we talk today, will be a theme of my career. Um, we were moving our hospital into a new tower. We built a new hospital and consolidating my 5 clinics down to 4, reworking the entire workflow. And in that process, got put into executive committees again, way over my skis, but we're around the right people. And another thing you'll learn about me through this conversation is I'm not afraid to speak up. So I did a lot of speaking up during that time, and was exposed to a lot of really new and interesting things. And at the end of that, Ohio State started building their own hospital right down the road, about 5 miles down the road. And their emergency department was moving to a new place, and they came and asked me to be their quality manager. And during that process, I said I just moved a health system. I know that the design for the system that we're moving in 2 years was done 10 years ago, and you already know that much of it's outdated. That it's not going to work for your existing flow. So, what are the big problems that you see right now, and how can I help you fix them? And the hiring manager said to me, "Well, in emergency departments, there's 3 things that people complain about, and it won't be surprising to any of you. Wait time's number one, noise is number two, privacy is number three. Naively, they thought by building the biggest or the biggest emergency department in the state, they'd get rid of the wait times. But you're a operations guy, you know that doesn't fix the problem. Um, so they weren't going to put doors on any of the new beds that they were putting in. So they weren't going to address privacy and they weren't going to address noise. I said, "Well, you already asked me to come back for our second interview, so let me come back with a solution." And in that process, I came up with my first invention, which became my first startup called Quality Health Communications. And essentially, this is back in 2012 as the Accountable Care Act had just come out, and there are new metrics, and the EHR was finally starting to hum along. We came up with a way to interface with the EHR to directly project patient quality images on their door. So we put a privacy film over the door. It solved the noise and the privacy problem for them because there'd be a door now. And then on that door, it basically became a TV. We put a short throw projector outside, and then we took 15 of the most important quality metrics that our department determined, and then there'd be badges on the patient's door. So you could stand in the middle of the hub and look around and say, all right, room 2 needs an EKG in the next 3 minutes, or we're not going to hit the door to EKG time. Or room 5 needs a CT scan, or we're not going to hit the stroke protocol. And then as it was charted, it would disappear and the next thing would pop up. So that process, Dave, took me 5 years to go from invention disclosure at Ohio State to pilot. And some of that time, we had a death in the family. We considered moving to Nebraska. Like maybe 6 months to 18 months, 8 months, you can attribute to delays on my end. But about 4 years of that was the system not being set up for clinicians to bring their ideas to market. So during that time, I kind of became the go-to clinician at Ohio State of if you have an idea and you don't know where to begin, where do you start? And so I got recruited over to the College of Nursing, who had a really dynamic dean there who was focused on innovation, and became the chief innovation officer there. And we started what was called the Innovation Studio, which is a movable maker space. It kind of looks like 16 by 16 hockey rink cubicle. It's got plexiglass all the way around the outside so you can see in. But inside's the modern day shop class. So we'll have things like drills and saws and things you'd have in shop class, but also 3D printers, laser cutters. And the whole idea was, we know that there's this barrier in our system that people just don't know where to go, where to begin when they have a great idea. So let's just create the physical place that you walk into, and that's where you begin. So As the chief innovation officer there, I launched the innovation studio, or we launched the innovation studio in 2017, ran that through 2022, and then left to join a startup, which was called And Health, which at the time was a functional medicine startup, and then left that and joined Steadywell, where I'm now the co-founder. So it's been a wild journey. It's like a very bent arrow, as one of my mentors likes to say. But it's one of the great privileges of being in nursing because there's so many doors to knock on and so many paths to go down.
Bent arrow indeed. I'm stealing that line. I don't know
Yeah,
who served that up to you, but I love it.
yeah,
Well, fantastic. Thank you for the brief history of time, man. You have done an awful lot in a relatively short period of time. So let's talk for a minute about Steadywell. Steadywell
yeah.
is still, would you say, in startup phase?
Yes, very much so. We are a seed stage startup right now. We're actually in the process of raising our seed fund. We were launched in August of 2024, and we're recording this in February of 26. So just over 18 months old, um, and learning a lot, and there's a lot of growth at this point, not a lot of comfort. So it's a fun place to be in, and we're really enjoying it.
What does Steadywell deliver to clients?
Yeah.
And what was the impetus to start it? A lot of people have a great idea, but
Mhm.
what's interesting here is that you already are an innovator with your history and the innovation studio and saying, hey, if you got a great idea, bring it to Tim. He'll help you sort it out. So you're savvy to innovation, but what was the impetus for Steadywell and what do people gain from being a client?
Well, I'm a co-founder here, so the real story comes from Josh Kermish, our founder's journey. So his mother was the volunteer coordinator at Mayo Clinic, and as he likes to say, it's this amazing facility in the middle of the cornfields of Minnesota that has almost unlimited resources. Like if you need something in healthcare, it's one of the few destination places to go to that you can get something almost exclusively there, not exclusively, but it's one of the few places in the world that can deliver it. So she was very passionate about advanced care planning and people understanding what type of care they'd want at the end of life. And about 6 years ago, one Saturday, she woke up not feeling well and ended up going to the emergency room. And she was diagnosed with the flu. And six or 7 hours into that, as she was getting discharged, she got up to leave and collapsed. And it wasn't the flu; it was a stroke, and she ended up receiving heroic amounts of care, as you would at such a great facility. But unfortunately, her advanced care plan was in the wrong part of her chart, and the care that she received was not the care that she actually wanted. And so, Josh and his family had to make some really tough decisions, and she never came home from that experience. So, there's he was motivated because he saw failure modes in the advanced care planning process, but also in the lack of proactive care that came along with it. His mother had some other health issues that could have been more proactively managed and perhaps led to a different outcome. But those things just aren't in place right now because, as we all can attest to, our health system is entirely reactive. So Josh and I met, and my wife is a financial planner, and we've always talked about not only planning the different ways that you measure wealth in your life. You have the monetary component, but you also have the health component, and making sure that you are investing as much in your health, whether that be through physical behavior or through proactive engagement, is incredibly important. So when I met Josh, the next morning I woke up and thought this company is going to create the 401k of healthcare. We're going to create a proactive way to manage our health so that we can think about the things we want, not just today or tomorrow, and not just at the end of life, but everything in between, and make sure that we're making investments wisely at each stage so that we get the outcome that we desire. So, in essence, that's what we're doing at Steadywell. Is for our clients, for the patients who work with us, they are getting a tool to proactively engage in the breadth of their health. Typically, right now, we're engaging with patients with serious illnesses or multiple chronic illnesses. Again, that's where healthcare is focused and where a lot of the funding and payment can go. But eventually, we'd love to be the household name for proactive care in healthcare, and really being able to set people up for a successful journey throughout the ups and downs that occur in life.
Well, you have a couple of organization names on your website.
Hmm.
So I'm hearing you talk on one hand about B2C
Hmm.
and also B2B.
Well, that's a great point. And a challenge now because we are an AI company, and there's a lot of conversation about AI replacing the human element of healthcare, and we're trying to do exactly the opposite. We're trying to superpower the human and make sure that they have the tools and resources they need to reach out to. So our end user are patients, but our clients are physicians' offices, health systems, anyone that delivers care to patients. But because we're leveraging AI and superpowering them, we're also really serving as an invisible workforce. So most of what happens from SteadyWell happens behind the scenes, and clinicians aren't even aware of what's going on until a moment of need is identified. So what we do, in addition to help patients generate their plan for what they'd like, what type of care they'd like, and when, we proactively manage and reach out to patients. So, Dave, when was the last time your physician called you to ask you how you were feeling?
Fair
Okay.
point.
Yep. So, a great example of just the reactive nature that exists in healthcare. What we've done is identified a voice AI agent. It's a piece of software that can call you and sound like a person that you'd be talking to in real life. But there's no veiling this. We're always forthright of saying, "This is Sam, your AI agent, calling on behalf of your doctor. It's
Right.
time for your regular check-in. How are you feeling today?" And then based off of your responses to that question, if you say, "Hey, Sam, I'm feeling great," Sam will say, "Dave, I'm so glad you're feeling well. Let me just check up on a couple other things. You taking your medications as prescribed? Are you doing these things? Or any changes to your activities of daily living?" Nope. Okay. I'll call you in 2 weeks or 5 days or 30 days, depending on your illness and how frequently the health system wants to check in with you. We can specialize that for you. But if you did say, Sam, I'm feeling kind of fatigued today. Sam's going to go through about 15 different questions that will get to the source of your fatigue, and then the health system or the physician's office will have set parameters of when they want a client to, or when they want to be reached out to, uh, if a patient's not feeling well. So if you said, "I'm just feeling a little tired today, I didn't sleep well last night," that's going to trigger a different reaction versus, "I haven't been able to get out of bed for the last day, um, and these other things are going on." So the way that we're superpowering the humans is right now, there either aren't people reaching out proactively, or if they are, they're part of a system that has specific parameters on them, or maybe that they're in a CCM model where they have to get 20 hours or 20 minutes of contact with patients per month. So
Mhm.
they're typically just developing their own spreadsheets, calling a patient, whether they talk to them or not, they end up charting that they've spent that time in the patient's chart, and that's what happens for the month. With us, we're going to call the patient. If we don't hear from them today, we're going to call them back tomorrow until we get them on the phone and see how they're doing. If they're not doing well, we say, "Dave, I'm sorry you're not doing well. Your nurse Tim is available at 1:30 today. Can you talk to you then?" And then we schedule that nurse, and that becomes their superpower tool, their crystal ball to see, okay, Dave's not feeling well. They can then go onto our portal and read the entire transcript of the call. They can listen to the entire call if they want, or they can read a summary of it. And then when they reach out to you at 1:30, they already know what's going on. They can get really pointed about their questions and make sure that you're directed to the appropriate level of care. And then instead of going back to the old way of just continuing to call people and chase patients, at 2 o'clock or at 1:45, the next call set up, and it's another patient just like you who has a qualified need. So we're moving all of our clinicians to the top of their license, and they're no longer chasing patients. They're providing the right care at the right time.
Well, that phrase operating at the top of their license is more popular all the time, and
Mhm.
it's the agnostic, whether it's primary care physicians, specialty, subspecialty. Uh, Physicians and their teams are working hard to do better.
Yes.
But in the traditional environment, it is very challenging because your point earlier about being reactive is absolutely on point for the state of the state right now. Um, so if you're leveraging artificial intelligence, what is the adoption mentality of your physician or
Mhm.
health system client? What are they seeking to solve other than better health for their
Yeah.
patients?
Because better health is table stakes. But if we get really candid about it, what health systems want are workflow agnostic solutions that produce financial results. And so that's we do that. I think we also provide better care, and those are the things that we're most proud of. Our NPS is 86. We do a great job in reducing the cost of care, which has benefits for both risk-bearing health systems and, most importantly, patients. And then we also help patients get to the right point of care at the right time. So we reduce hospitalizations, but we also reduce deaths in the hospital or unwanted deaths in the hospital. So that, again, when you invest in your future and you decide where you'd like to be in the last chapters of your life, we have a clear plan outlined for that. And that's more cost effective for both patients and health systems as well. Um, let me get back to the other part of your question. Why do they want to engage with us?
Yes.
Um, beyond those reasons, I think it's also part of our duty now. And AI is a scary thing. I'm the first to admit that. I think responsible AI adoption is an imperative of what we have moving forward. We saw what happened when we let the EHR revolution become what I believe to be, it's pretty close to monopoly now, and it stifled a little bit of innovation across healthcare. I'm really nervous that that's going to happen again if we don't adopt AI appropriately. So what we are doing, and I think what makes this a little bit more unique, is that we are clinician designed. We are purposely driven. All my work at the innovation studio was to find ways to require the least amount of behavior change possible, because our system is hit with so many data sets and data points at any point in time. If you change one behavior, it might throw the whole system out of whack. So how can we do things that are workflow agnostic and enhance the experience for both, or actually, really it comes down to achieving the quadruple aim. So how are we going to focus on things that are workflow agnostic that help us achieve the quadruple aim?
What you described for steady well,
Mm-hmm.
at least what I heard is by practitioners for practitioners,
Yes.
so that it's not a, with all due respect to the incredible technologists that create things, this is the intersection of clinical care,
Mm-hmm.
ability to operate at the top of one's license, and leveraging what should be world-changing technology. Is that
Yes. And the
fair?
point I didn't get to make yet, Dave, is that I think it's a responsibility of us to leverage world changing technologies that, with the caveat, don't replace the human element of care. Like there is a, if just because we could doesn't mean we should, threshold that we need to absolutely identify when it comes to AI. The things that we're working on right now have, in my eyes, and maybe this is naive, no potential impact on reducing FTEs. I actually think it has the potential to increase the amount of humans that are working in healthcare, because we can do more, and we know that people aren't getting enough healthcare right now. Like, for example, our first health system that we're working with has 55,000 patients over the age of 65. We know that 68% of them have multiple chronic illnesses. So let's just call it 40,000 patients. Guess how many of those patients prior to us were receiving some type of proactive care? Less than 1,000. So when we recognize that the technology exists, but the things that have been holding us back are the humans to superpower that technology. It goes both ways. We need humans to superpower the technology. We need the technology to superpower the humans. If we can find a way to better reach those patients and do it in a way that improves, which has traditionally been one of the worst health systems in the developed world, particularly when it comes, we're wonderful at tertiary care. If people come all over the world to get the most complex care from the United States. But when it comes to the things that we're focusing on of chronic disease management and caring for people with serious illnesses and making sure that we're not overutilizing services that aren't providing benefits. We spend over $138 billion a year of end of life care that neither improves quality of life or alleviates pain for patients. So if we're spending that much money, clearly there's other resources that we could direct those dollars to that can achieve those things of improving quality of life at the end of life, or throughout the continuum of care for people with chronic illnesses.
There's so many different places I want to go with this.
Yeah,
And
let's do it.
well, there may be Megaphone Part 2 with Tim Raderstorf in the future. Um, if you look into your crystal ball,
Mhm.
not necessarily specific to SteadyWell, but
Yeah.
clearly you and Josh have done the research around artificial intelligence to determine how it can be that superpower.
Mhm.
So, what elements of healthcare should we expect artificial intelligence to improve from your perspective?
My perspective, I think it comes to a lot of operational efficiency components. So, coming from an innovation background in complexity theory, I believe that all systems are perfectly designed to get the results that they receive.
Sure.
So right now our system is very much out of whack. And one of the reasons I think it's going to take a long time for healthcare to effectively adopt AI is because it is going to require so much behavior change. So where I think that we see things changing the most are one, administrative tasks behind the scenes that um, probably improve billing and the things that unfortunately drive the ship the most in healthcare right now. Um, what I do think is the next lower hanging fruit is the optimization component that we're working on now. So when it comes to
What's an example of that?
so I'll use Steadywell here. So right now with the chronic care management nurses that we worked with in the past, they were creating their own schedule using spreadsheets. And then they're crossing them out every month as they go through, or highlighting them that they need to do something else, or developing their own. They're as frontline clinicians, you're always innovating, you're always working around the system that's there for you,
Right.
unless the system actually helps you. And right now, I don't think the system is set up very well for frontline clinicians. So they're working their full day, they're working hard, but because of the tools and the system that they're in, they don't have the capacity to move beyond 200 patients per month. Because we reach out to patients proactively and only find patients with a qualified need who need their license, and in this moment they're able to increase that panel of patients from 200 to right now we're confident at 1,000. We think that may go up to 1,600, 2,000 patients, because not everyone needs us every day, but they need someone at every point in time. And with the right information, and it's not going to be that challenging on our end when we have enough data to figure out when these influxes of patient needs come from. We're going to be able to have the right patient being connected by the right licensed professional. So that could be an RN at one point, but that could also, if it's a mental health need, be directed to a psychiatrist or psychologist. It could be directed to a social worker for SDOH. So there's a lot of licenses at play here that are all chasing people right now instead of having that qualified person show up at their doorstep at the right time. And so that's where I think some AI is going to be really effective and be on the market in the next couple years. I don't know enough about, some of the other fancier, exciting things like personalized medicine and drug development, but I also think that's on a relatively similar timeline as to its effectiveness. I think there's a lot of behavior change that has to occur in that for those drugs to get to market faster. But that's a tale of as old as time when it comes to drug development.
We've had other mentalistas comment similarly, and you're right. Several have said, look, if you think that technology and drug development have come a long way in the last 10 years, you ain't seen nothing yet. And
Yeah.
they're talking in some cases terms of just months
Yes.
for significant progress, which is very exciting. It is interesting the way you frame it, that the optimization opportunities really start with kind of the boring back office stuff, but that may be a good landing spot
Mhm.
for some of the technologies that we're seeing now. I am going to give a slightly different take on something that you
Please.
mentioned. And yes, healthcare is slow to adopt many things. It seems pretty clear, though, that artificial intelligence is being adopted not by design, more by default
Mhm.
in a lot of different ways. So it's really not being used in optimal
Right.
fashion because folks are just reaching out saying, hey, man, I'm on ChatGPT. I'm going to use Claude. I'm using Copilot. And they're kind of doing their own thing. And we're also hearing more and more that organizations are trying to come around what good governance means.
Yes. And moving beyond the FOMO right now. So, like, I think there's some of our peers, and this isn't a tactic that we use, but some of our peers are selling on the, hey, if you don't get on the ship, you're going to be left behind. And, um, what we like to say is if we're not getting on the ship together, we're both going to be left behind. That we need to figure out what that governance packages are. And we are fully committed to making sure that this is an add on for both your staff and your patients. So, taking our time, taking a breath to understand how these decisions are going to impact is incredibly important. But conversely, you do have to keep your finger on the pulse of what's happening elsewhere, because if things are getting adopted universally in other areas that aren't being vetted, um,
Yes.
it does force your hand a little bit to move faster, and hopefully move faster on, one of my big passions is making sure that as clinicians, we have this responsibility to make sure that we are the change that comes forward here. And as people who have administrative buying power, that they are leveraging that and not being that they're not even being first followers, that they're being leaders and making sure that they're vetting these things themselves and not doing what we've almost always seen in healthcare of saying, well, Mayo Clinic's doing it or Cleveland Clinic's doing it, we should do it too. Um,
Sure.
it's great that they have the resources to vet them, but it's not a one size fits all solution. And I think we need to be really careful about how we make these decisions, but also be expeditious enough to recognize when an opportunity presents itself.
Well, it is unfortunate that maybe some of the organizations that claim to do what Steadywell does or are doing adjacent things are really just selling software. What you've described as Steadywell for you and Josh seems to rise well above that, and there's a mission below everything you're doing that seems to be the touchstone for what you've described to us today.
Absolutely, it all comes down to making people's lives better. And it's I consider it a huge privilege to be able to be developing these types of technologies and to be able to be bringing them to market. Um, I don't fear that the technology isn't going to improve lives. I fear that it's not going to improve enough lives, and that's the real sense of urgency I have right now at being this stage of a company is how can I get this out to as many people as possible? And sure, that has financial benefits for me. It has financial benefits for my family and community.
Of course.
Um, but the real driver behind that is I know that this can change lives, and if we are not adopting something that's developed by clinicians for clinicians, something else is going to take its place, and that's where that weight and that responsibility comes from, because I know that we can change lives. I just want to make sure it's as many as possible, and we're doing it from the lens that I think is comes from a pretty unique founder story and a pretty unique founding team's journey of how we landed where we're at today.
Well, the executive producer and director and all things good about Megaphone, Maria. Maria, just if we could double click on the idea that Tim Raderstorf Part Two is going to have to be something that we do in the future because we've got a lot more to talk about.
Sign me
Um,
up.
and so many different paths to explore. Um, Tim, before we let you go, Maria and I are keeping a travel log. It's getting extensive now, so hopefully we find the time to use it at some juncture. But we ask all of our guests a couple of things. One, what's the must-do thing where you are? What do you like to do? Get outside, I hope. And also, good restaurant recommendations for your neck of the woods. So when we come visit, what are we going to do and where are we going to eat?
Columbus, Ohio, the thing that you have to do is come and experience a football game at the Horseshoe. It's the third, fourth largest, depending on what list you look at, stadium in the U.S., and it's a pretty dedicated fan base. So whether you're a fan or not, it's worth seeing what of production that is. Food wise, there's 1,000 different places to go. We have a restaurateur here named Cameron Mitchell who started probably 20, 25 restaurants in Columbus, and it's kept all of the restaurants incredibly local. So there's, when you drive down the main strip of Columbus, you're not going to see a lot of familiar names. And it's one of the best things about the city. So anywhere up and down High Street, you can't go wrong. One of my favorite places, though, is a place called Bassi Italia. It's in the short north, and it's actually in the backyard of a house on one of our main Victorian streets. So, really unique dining experience there, and would love to take you there when you come to town.
Perfect. So we're going to go to a game. We'll see the Ohio State University, especially the script when they spell
Swift,
out
Ohio.
Ohio,
Yep.
which I've only seen it on television. It looks
Yep.
fantastic. And Basio Italia.
Bassi Italia, basil
Bassi
without the I.
Italia. All
Yep.
right.
And we
Got
can
it.
walk to all those places. So we'll be on our feet
Beautiful.
the whole day.
Well, Tim, you get the last word today. What message will you leave us with?
Thanks for that. I don't know. I've sent you many emails, but I end every email that I have with the phrase "many thanks" and "be curious." I think curiosity is the key driver that makes human connection worthwhile. So just thank you for the opportunity today, and encourage you to be as curious as you can be today.
Thank you so very much. We've been chatting today with Tim Raderstorf, co-founder of Steadywell. That's all for this edition, but join us next time for Megaphone from Medville Media. I'm Dave Self. Be well.